Welcome back to movementprofessional.com. So today I want to discuss terminal knee extension and some exercises to try to make that better. And first I want to discuss just the concept of it. Something that's really important after like a knee surgery, so if you have a total knee replacement or an ACL reconstruction. It's also going to be something that if you're assessing functional movement, if somebody can't get terminal knee extension, it could lead to knee, lower back, hip, and also ankle disorders, just because the whole chain is going to be affected. All right, so what we're talking about with terminal knee extension is, if you see me from the side here, it's basically being able to straighten my knee fully, turn my quad on, all right, so I get 0 degrees extension at least. Okay, some people may naturally have a little bit more, which is called a genu recurvatum, so a little bit of a hyperextension. All right, so we'll talk a little bit more about hyperextension as we go into this, but important thing to know with terminal knee extension, like many other things, we're talking about a single joint. So it's not just about the knee, it's about the functional activity of like, what are you doing when you need your knee to be fully extended? So if we look at something just like walking, for instance, then I have to be in a stance phase. So if my knee doesn't fully extend, that means my hip won't be able to fully extend. I'll have to do some type of compensation. So I'll either kind of slouch here, or more commonly, I will be in a more hyperextended lower back position, anterior rotated pelvis position. So I'm in flexion of my hip, so I can be in flexion of my knee. All right, so being able to fully extend at the knee, I'm able to then fully extend at the hip. All right, so stance phase of gait is the most functional thing you'll be doing the most frequently as a human being. But then if you look at exercise, so anytime we're doing a step up, so if I have to step up with this leg, I also want to be able to fully extend this side, or there's going to be some type of compensation. So if this knee has to stay slightly bent, and it just could be, you know, a degree or two, then my hip has to be slightly flexed, and then something's going to happen at my pelvis. There'll be some type of compensation. I won't be able to strengthen my muscles in the same way. The distal part of my quadricep won't be able to turn on the same way. I'll likely have some restriction in the distal part of my hamstring closer to the knee. All right, and then I'll be in some type of anterior tilt, kind of cross pelvic syndrome, likely up in the pelvis. So very valuable thing to, and you see that it's a difficult thing to work with when somebody is post-surgery for a knee. All right, so first thing you want to do is assess it. So if you get onto the ground, so let me get into a place where you can see me here. So if I'm on the ground, I just want to be able to look at both knees and see that I can, one, get my quad, which is the part going right into the kneecap, that it looks like I can contract the muscles pretty equally, and then I can get both of my knees pretty close to the ground. All right, so really we're looking for symmetry. So if I'm hyperextended on one side, I want to be hyperextended on the other side a little bit, but it doesn't mean I want to be kind of functioning with a hyperextended knee, but I want to know if I can hyperextend on one knee and I can't on the other. It tells me something about my body and how I'm using it. All right, so I would look at it and I would look that I have pretty good symmetry there, but I can feel just by doing this that my left side kind of has to stretch a little bit more to get there. So that just gives me a sense of, I might want to work the left a little bit more than the right. All right, so it would be, if I was working on someone, I would have them completely supine, because you're able to tell more there. But for a self-assessment, it's fine to just kind of sit upright and just make sure that it looks pretty similar in how you can contract your quads and straighten your knees. All right, so then to work on it, the bands work really well. Okay, so one thing, you can start with like a really, like a kind of a moderate sized band actually, because what we're trying to do is facilitate muscle contraction. All right, so the heavier the band, the more facilitation of the quadricep muscle. So I want to put this right behind the back of my knee. All right, and then I'm going to walk far enough away that I feel that my knee is being pulled forward, and then I want to drive my heel into the ground, feel my quad tighten, but more importantly, I want to feel my glute tighten now. I want to feel like I'm pushing my leg through the ground, because it's really easy to compensate here. I can straighten my knee, but if I shoot my butt back, then I'm losing my hip extension, and I'm really going to maybe overextend this left knee, I won't be as strong and as stable here, and it's not a functional position, okay? Because I'm not trying to straighten this knee, I'm not trying to get terminal knee extension just for the sake of doing it. I want to do it in a functional position. So to me, it's always about the center out. I want to make sure I can stabilize my midline so I don't arch my back. I want to make sure I can extend my hip, and then finally I want to make sure I can extend my knee, and then the feeling, the cue would be to just drive the whole leg heel first down through the ground. And I'll hold that for a bit and then let it go. So first thing I want to do is just start with getting this motion down in a bilateral stance, driving the heel down, feeling the glute, feeling the abs, then feeling the quad. 10 seconds on, maybe 10 seconds, or 10 repetitions. After that, I can get a little bit more dynamic with it. I want to maintain this position, and then I want to lift the other leg without losing this terminal knee extension. All right, so I could just make it easier by just having my heel down, so I'm in a stance phase, heel strike, like I'm emulating gait. All right, or I can be more in a rollover pattern of the back leg. All right, so more consistent with the stance phase of gait, though, I would be dropping my heel down, okay? So then I can march. I could be in a pose running stance. So let me show you from the side here. All right, I'm still kind of getting this sense of pulling back, but then I could be in a pose running stance, reaching this leg down, making sure I can feel my glute, feel my quad, put this down and up, okay? And then I could bend and straighten. You can also then try to do just mini one-legged squats. The quad gets real tired real quick doing that. So it's a nice little distal quad strengthener, but very specific to that terminal knee extension, okay? So obviously there's a lot of mobility that may need to be done on the back end or in the front end in order to get the knee prepared to do some of these more active exercises with the band. But often what you'll find is there'll be kind of this connection where you can loosen up some of the soft tissue around the area, the distal hamstrings, the hamstring as a whole, the hip flexors. Things start to loosen up, but then there's not the neurological connection of how to get the muscle to facilitate, especially after a knee surgery, because there's usually a lot of edema and fluid that fills in the knee, and just a little bit of fluid in the knee shuts that muscle off, and it doesn't allow the distal quadricep to work very well. So getting the muscle to facilitate using some resistance can be very, very valuable for that. All right, and then you just want to make it as functional as possible. So, the takeaway points are terminal knee extension is important, but don't make it just about the knee. Make it about this whole pattern, this functional pattern of a neutral pelvis, as neutral as can be, hip extension first, and then finally getting into the quad, holding that, and then looking for symmetry on both sides. If you have any questions, please feel free to contact me at movementprofessional.com. I'll see you next time.